are in the oral hygiene education room, and I'd just like to discuss some of the findings that I found. Is that okay with you?
Yeah.
Okay, so your health history was clear. There was no concerns there. The only concern that I did find was that you had a solid lump right underneath your chin, right about there. Yeah. And which we refer to as a submental lymph node. Were you aware of this?
No, it wasn't.
No. Okay, so did you have any like flus or colds recently?
No.
No? Okay, so because you didn't have any recent colds or flu and you didn't know about it, and it is an area of concern because it is solid, we would just want to send out a referral and just to ensure that it's not anything we should be concerned about. Is that something you're willing to do?
Yes.
Okay, so I'm going to send a referral to Dr. Moeller, and he's just located on Notre Dame. Is that okay with you?
Yeah.
Okay, so the next thing that we did find in your assessment was that you did have some cavities, about 4 of them, just located at the back of your mouth and on the biting surfaces of your teeth. Were you aware of this?
No, I wasn't.
No, okay, so because you do have cavities, I would like to educate you on the process of how they're formed, just so that we can prevent any more cavities. Is that something you would like to discuss?
Yeah.
Okay, so when you eat or drink anything that is acidic, meaning that it contains a lot of sugar, the bacteria in your saliva uses that to produce acids. And then those acids start to eat away at the enamel of your teeth, which is the outer surface, and then they start to cause holes, and then you get cavities.
Oh, okay.
Yeah, so because you do have cavities, I just want to educate you about some types of preventative measures so that you can ensure that you don't get any more cavities. Are you interested in this?
Yeah.
Okay. So fluoride does play a huge factor in the prevention of cavities. Do you know if you live in a fluoridated community?
I don't think so.
No. So because you don't live in a fluoridated community and you haven't had a cleaning in the past 4 years, I just want to go into a little more depth about fluoride and the importance of it. Are you okay with that?
Yeah.
Okay. So first thing, can you tell me what you know about fluoride?
I don't know much, but I know that there's some in water and foods, and I know that before when I would go to get a cleaning done, I would get like a 4-minute treatment, I think.
Yeah. So you do have a pretty good knowledge on fluoride. So when you go to the dentist, you do get a fluoride treatment because it helps with the remineralization of your teeth, as well as it strengthens and repairs the layer of enamel on your tooth in order to prevent cavities.
Okay.
So fluoride does play a huge role in making your teeth more resistant to those acid attacks from the bacteria in your saliva and the sugars in your mouth. So do you feel like my explanation explained fluoride a little bit better to you?
Yes, absolutely.
Okay, so I'm glad that I was able to explain fluoride a little bit better to you. So because you don't live in a fluoridated community, I just want to make sure you're getting the right amount of fluoride. So therefore, I would suggest some of these toothpastes and the rinses, and there's also tablets and drops. But I think for you, the rinses and the fluoride would be a good suit. Do you think that this is something you're interested in?
Yeah, absolutely. I'll probably go and get a toothpaste with fluoride in it later.
Perfect. I'm glad to hear that. So the other thing I'd like to discuss with you is your diet. Can you tell me what you eat on a day-to-day basis?
I drink about 4 to 5 cups of coffee a day, like
Okay.
throughout the day. And then for breakfast, I'll have a little oatmeal. For lunch, I'll have a salad. And for supper, I'll have chicken breast with vegetables and rice. Okay.
So your diet does sound pretty healthy. One of the concerns is the amount of coffee you are drinking throughout the day, because as we previously discussed, the sugar can cause an acid attack in your mouth, and then because you're sipping on coffee throughout the entire day, you're constantly allowing the bacteria in your saliva to continue to make acids, which then leads to cavities, and then so your mouth never really gets a chance to stop producing those acids.
Okay, so I'm constantly allowing my teeth to get cavities?
Yeah.
Oh, okay, that's not good.
No. So knowing this now, are you maybe interested in limiting the amount of coffee you do drink on a day-to-day basis?
Yeah, absolutely. I know it's unhealthy for me, and I'm the one causing the cavities, so I know that I could prevent it.
Yeah, exactly. So are you interested in setting a goal to drink maybe like 2 to 3 coffees a day?
Yeah, I think so.
Yeah. Okay, so that sounds good. I'm glad you're on board with this. So for your next visit in 6 months, we can assess and maybe hopefully set a new goal, and hopefully you've been able to reduce the amount of coffees you drink to 2 to 3 a day.
Yeah, okay, that sounds good.
Okay.
Okay, so another finding was that you had quite a bit of plaque, which is a soft deposit on all your teeth. So like this.
Okay.
We also discovered that there was what's called calculus, which is a harder deposit
Okay.
on your front teeth on the top and the bottom. So mostly right here. What can you tell me about that?
Well, I don't know much about the two, but I think that plaque is better than calculus.
Yeah, exactly. Calculus is a form of hardened plaque that is formed from saliva and the bacteria in the plaque. So what happens is that when you don't brush the plaque off, it sticks to your teeth and it hardens, turning into calculus. And the only way to get it off is by coming to the dental office to get a cleaning.
Oh, well, that's good to know.
Yeah, so it's important to come back every 6 months or so to get a cleaning done, and to limit the amount of calculus buildup. So, because it takes about 6 months to form. Is that alright with you?
Yeah, I definitely think I'm going to try and come every 6 months, just knowing that if I come to the dental office that you guys can help me with the problems I'm having.
Okay, great. That's good to hear. So now that you know what calculus is, we need to make sure that you're concentrating on brushing your front teeth and also your back teeth, but also not to forget to brush the entire mouth.
Yeah.
Okay. Do you think you can do that?
Yes, that's no problem.
Okay, so I'll discuss some techniques in a bit, but as we previously discussed about caries formation, do you know where your cavities are?
You said that near the back of my mouth, on my biting surfaces, but I'm not exactly sure where they are.
Okay, so I can show you on the Tip-It-On. Is that okay?
Yes, absolutely.
Okay. So when I show you, do you think you can point to your own teeth and so we can figure it out?
Yes, absolutely.
Okay, great. So there's one here on the top.
Okay.
It is on your right side, and it's your last tooth.
Okay.
Yeah?
Right here?
Yeah.
Oh, wow, okay.
Okay, and then there's another one on your left side,
Okay.
and it's the before last tooth.
Not that one, but right there?
Yeah.
Oh, wow.
And then
Okay.
on the bottom,
Okay.
again on your left side,
Okay.
it's the last tooth.
This one?
Yeah.
Oh, wow, I didn't know I had that many.
But you have one more, and it's on your right side, on the bottom again,
Okay.
and it's your before last tooth.
Oh, right here?
Yeah.
Oh, wow, I didn't know I had that many. Is there a way that I can prevent them?
Of course there is. I'm glad you're interested in learning more. So brushing and flossing will decrease the amount of cavities that can form in your mouth, as well as fluoride, as we previously mentioned.
Okay.
And it is important to brush at least 2 times a day and floss at least once. Sometimes using a new toothbrush is more, that is more aimed towards your biting surfaces would help too. So since your cavities are all on your biting surfaces, would you be interested in me introducing a new toothbrush?
Absolutely, I want to know how I can prevent this.
Okay, great. So because your cavities are located on your bite surfaces, I think it would be best to use the Complete Care toothbrush.
Okay.
It has different levels on the head of the toothbrush.
Okay.
And it'll clean the cracks and crevices on the molars. So if I show you like this, you can see it brushing into the cracks. Same on the top. When you're brushing, you'll be pointing your toothbrush like this and making sure that you're getting into all the little cracks.
Oh, wow, okay. Okay, so I...
Great, that's perfect. I think that if you keep brushing like that twice a day, it'll minimize the bacteria in your saliva that can cause cavities, and brushing can also reduce the amount of stain that you have on your upper and lower teeth on the inside that is due to the coffee stain. When you come back in 6 months, we can reevaluate your teeth again and see how much you've improved. Does that sound good?
That sounds great. Thank you very much. I wasn't aware that I could actually remove that stain.
Yeah, removing that stain is possible. So I just want to ask you the importance of how brushing has changed for you now that you've learned more. Are you okay with that?
Yes, absolutely. So I know that I need to brush 2 times a day, and I also need to floss in order to reduce my cavities and the amount of stain that I have on my teeth due from the amount of coffee I drink on a day-to-day basis.
Yeah, great. I'm glad you understand. I was wondering if you wanted to set a new goal until our next appointment together in 6 months. Would you like to do that?
Yes, I would love that.
So what would you want to make your new goal?
I think that I would like to reduce the amount of cavities that I have. Does that sound reasonable?
It does, yeah. How would you like to do that?
I'm hoping to reduce the amount of cavities that I have in my mouth by after breakfast I brush my teeth, and before I go to bed I brush my teeth, and then also get some flossing in there probably 1 to 2 times a day.
Okay, great. So if you don't succeed like you wanted to, it's all right, because you can keep trying, because sometimes it's hard to change and start a new routine, and you're not the only one out there, right?
Yeah.
I know that it can be done, and I know that you can do it, so it's just a matter of getting it done.
Thank you very much.
You're welcome.